Thank you, Madam Chair. Good afternoon. And Mr. Secretary, thank you for being here today. It's not the first time we've seen you, although here I think this year probably, but certainly we appreciate the work you and your team have done dealing with the coronavirus. I think I've been in every one of the roundtables and hearings that you and your team have provided for this committee and other committees. Chairman Pallone and I were the co-moderators of the first one in the Visitor Center where every member of Congress was invited. And I was at the last one, and I was at the Situation Room at the White House before the break. And this, I think you all have been very forthcoming with the facts. And for whatever reason, we haven't had a hearing here, maybe wanted to wait till this one, but I think it is important that we hear from you and the team that you're leading. And I think it's important to recognize the work that Mrs. Brooks did on reauthorizing the Pandemic All-Hazard Preparedness Act in the last Congress. We had big fights about that, but thank goodness it's in place because it's designed to do exactly what we're encountering today. Have a lead person in the administration, that is you, designated by the President, and a team ready to go. And so I guess I've been to enough of those briefings that I saw members kind of yawning at some point in those quote-unquote closed-door briefings because we're hearing it for the third time. Now, we were gone a week, and a lot's changed, and we know what's happening in China is probably worse than we're being told, and I think the big issues there are supply chain as well as public health. We know it is spreading around the world, and we're trying to cope, and we know, and you've warned us, and Dr. Fauci's warned us and others expect it to, this could well mutate, but that doesn't mean end of world. It can well expand. We should be ready for that. But as Mr. Pallone said, we have a terrific public health system here in the United States. A lot of that is driven at the local level, and it's important we have those communication links in place so that when we identify something, somebody coming in through an airport, the local health officials know about it at home, and we're able to deal with it. And I think it is good to get this out in the public. I would just point out that we will hear from you and the CDC, FDA, and ASPR and NIAID to give us an update on the sidecar hearing. We have had now, 80,000 confirmed cases worldwide, 2,700 deaths. The outbreak's become a significant global health concern. Yesterday, Italy announced 300 individuals have been affected by the coronavirus. 11 had died. There's still much we do not know about the outbreak. And so we'll learn more, I guess, after this budget hearing. But it is essential that we do everything we can and provide you the assistance. And I know in the meetings I've been in with everybody else on this committee that was there to attend, you've made it clear if you need more money, you'll ask us, and we've made it clear if you need more money, tell us, and we'll work with you. Now, we'll want to get the specifics, obviously, but I know you've sent up a supplemental request for, I think, a total of about a little over $2 billion, $2.5 billion. Some of that's reprogramming, some of it's additional money. No sooner had that left your office than some politicians were on the air criticizing you for not asking for enough. And so we'll be interested to get your response to that. I do think it's also essential to look at perspectives in terms of what Americans are facing today with the traditional flu, and that we've probably lost, 10,000 or more Americans have died from the annual flu. And we have vaccines for that and treatments for that. And so we have to think about that as well and practice good public health. I was in Japan with a couple other of my colleagues on the committee, and you can't go anywhere in Japan without the hand sanitizer being squirted in your hands. And it was a good lesson, I think, for all of us, but we ought to be doing a little bit more of that here, and we'd probably help with the traditional seasonal flu and spread of other diseases. And so there's a lot we can learn from you, there's a lot we can learn from your team, and we'll look forward to hearing from you directly on that, on the record here in the public. So with that, Madam Chair, I yield back.